Well, I mean, it's important in that obviously Congress legislated this program so that discounted drug prices would be going to the people who are in need of them, and the covered entities that are able to make use of the 340B discounted drug are able to use those funds to expand services to the same needy population. If these services are not being provided to the right people, non-patients of the health center, or something along that line, or if they're otherwise being used inappropriately, then the program really isn't doing what it's intended to accomplish, which is to serve the people that are in need of these services. And being able to provide prescription drugs to these patients at a discounted rate basically allows the health centers to do two things. One is to provide necessary prescriptions to people who need them, low-income people who need them, but also because they're able to purchase the drugs at a discount. The difference between what they pay for those drugs and what they're able to get reimbursed, particularly from Medicaid, et cetera, allows them to use those additional dollars to provide additional drugs, to serve more patients, and in many instances to provide other services that they otherwise couldn't provide. If you don't have prescription drugs, if you don't have the drugs you need, your diseases, your sicknesses get worse and they become much more expensive. One of the things that the health centers take pride in is that by providing primary care up front, their patients tend to be low-cost patients down the road. They're less likely to go into emergency rooms. They're less likely to have diabetes or the kinds of diseases that become much more problematic if they're not treated appropriately and early on. So 340B drugs are essential to that. It allows community health centers to be able to afford to provide drugs at a price that allows them to serve a huge needy population throughout this country, and it's an important source of the health center's ability to take care of their patients.